Welcome, welcome, my dear friends. Myself, Professor Dr. Rajendra Raghuveer Deshpande from Pune, Maharashtra State, would like to welcome you all in my Ayurveda Academy YouTube channel. As you know, I am MD in Ayurvedic Medicine and MD in Ayurvedic Physiology. For paid online consultation, you can definitely WhatsApp on 92268106330. Right. The number is also in the description. My dear friend, this is the series going on where Dr. Deshpande is discussing the different problems by which the patient come to the doctor, and then general practitioner or family physician, how he can start thinking about that particular problem, health problem. And we are discussing the different health problems. This is a series. Nearly, I think 18 to 20 videos are there. I request all of you to check. Each and every video is fantastic and very interesting. Now, today's patient is 34-year-old female. Come to the doctor and she is complaining, doctor, I get palpitation very often. Even if I walk a little, I start palpitation. Even doctor, somebody talks loudly to me, I also start palpitation. My dear friends, doctor no, but the common man, if he is seeing the video, what is palpitation? Palpitation is nothing but you can feel your own heart sounds. Everybody is having lub, dub, heart sounds. But they are not audible to ourselves, not to oneself. But when the person can hear his own heart sound, which is not normal, then that is called as a palpitation. This is 34-year-old female is complaining about palpitation. Now the doctor start thinking, the commonest cause of palpitation is anxiety and tension. This is very common. But general practitioner, family physician, don't stop and say full stop, anxiety, palpitation. No, he should think of the other causes of palpitation, and for that matter, he will do the history taking, asking many questions to the patient, and will also do the different examinations. So let us start. 34-year-old female palpitation. The doctor will ask to the patient, tell me, madam, that palpitation are always there? That means throughout the day? No, doctor, it is nothing like that. No, that means it is not 24/7, doctor. Sometimes I feel that. Okay. So the patient is not having palpitation throughout the day. That is better, doctor think in his mind, because permanent this palpitation can occur in left ventricular hypertrophy, LVH, or that is called as a sustained tachyarrhythmia. Sustained, continuous tachyarrhythmia will be present in left ventricular hypertrophy, LVH. That can be diagnosed by, yes, 2D echo and also by the ECG. Okay, madam? Then doctor continues the history taking. Do you get the palpitation only during the exertion or even suddenly during the rest? Doctor, my observation is better. It is always only after exertion. Only after, if I do some walking and all this thing, some exertion, then only I get the palpitation. Now, if that palpitation is not related to the exertion, try to understand. Here the lady is making a connection, exertion and palpitation. But if some other patient says it has no relation with the exertion, it is a continuous palpitation, then it is more likely to be arrhythmia, heart problem. Rhythmia and arrhythmia. Normally our heart sounds are rhythmic. Love, dub, rhythm. Rhythm is there, but this palpitation is like a fast, and this is arrhythmia. Rhythmia and arrhythmia, no rhythm, no rhythm. Okay. My next question to the madam, are you taking any medications? Do you are having some other problem and you are taking some medicines? No, doctor, I am perfectly all right. I don't have any medicines right now. I don't have any, what you can say, the problem. Okay, good. Thank you. See, doctor is thinking that palpitation can be side effect of salbutamol or asthaline, which is anti-asthmatic tablet. This palpitation can be side effect of vasodilators. So medicine side effect, it can cause also palpitation. So doctor is asking to the palpitation patient about the history of any other medication for any other problem. Okay. Then doctor will start examining the most important feeling of the pulse. Pulse examination is very important in palpitation. Feeling of the pulse, but that should be very careful and for minimum 15 seconds. Ideally it should be 1 minute, but minimum 15 seconds is essential. If I normal pulse rate 72 per minute, if that pulse rate is like more than 100 or 100 all the time, that is called as a tachycardia. Pulse rate is more. If it is less, that is called as a bradycardia. Tachycardia, more pulse rate. Bradycardia, less pulse rate. So if now we are talking about tachycardia, excessive pulse, that can occur in hormonal problem. Thyrotoxicosis. Thyrotoxicosis is one of the important cause. Also, it can occur in cardiac problem like RHD, rheumatic heart disease. So rheumatic heart disease also can cause tachycardia. Okay. Then there is one disease which is called SVT. I will explain it afterward. SVT also can cause tachycardia. If that pulse is irregular, normally it should similar here. Tak, regular. But if this is something irregular. So if pulse is irregular, it can suggest atrial fibrillation or ectopics. Atrial fibrillation or ectopics. Everything can be diagnosed with making ECG, electrocardiogram. Okay, doctor is moving further for the examination and he will check, yes, pallor, paleness of the conjunctiva, very important examination, and also the nails for paleness. Also about the nail, I have repeatedly telling you platinikia, flat nails, or spoon-shaped nails, coilynikia. So conjunctiva pallor, nail pallor, problem with the nails, platinikia, coilynikia, indicating anemic condition. Anemia is a less red blood cells or low hemoglobin count. Normal hemoglobin 12 to 14 gram %. If it is less than 10 gram %, mild anemia. Less than 7 gram %, moderate anemia. Less than 5 gram %, severe anemia. Can be heart stop at any time. So blood transfusion should be given. Now we are talking about palpitation today. In this video, severe anemia also can cause palpitation. What is palpitation? I am revising. That feeling or hearing of our own heart sounds. Next, doctor will continue the examination of neck in the sitting position and ask the patient to drink a little bit water. And he can look for the thyroid swelling. If goiter is present, then also doctor can check for thyroid thrill at the upper pole. Thyroid thrill at the upper pole. He can also look for the X of thalamus. X of thalamus, that is eye sign, and also for the tremors of the hands in the thyrotoxicosis, hyperthyroidism, tachycardia. Patient is feeling very hot, very hot. Even in the cold season, the patient is feeling hot. Oh my God. In the cold season, if the person is saying, I require the fan. In the cold, patient wants the fan. Check for thyroidism. Hyperthyroidism is excessive heat in your body. Excessive heat. Basal metabolic rate is increased. Hyperthyroidism. T3, T4 and TSH is a blood test. So tremors are there, tachycardia is there, resting tachycardia is more important. And also the patient is losing weight. Weight loss will be there in thyrotoxicosis, hyperthyroidism. We are having the patient of palpitation. We are making differential diagnosis. Now the doctor will examine very carefully about the cardiovascular system, heart. Doctor will check apex bit, where it is, because in left ventricular hypertrophy, it can be little shifted. Then doctor can examine parasternal heave, HEAVE, parasternal heave of right ventricular hypertrophy, RVH. And of course, doctor can hear murmur, that is abnormal heart sound of RHD, rheumatic heart disease. What is murmur, doctor? Murmur, MUR, abnormal heart sound. Normal heart sounds, lub, dup, but lub, dup, lub, dup, lub, dup, this is abnormal by stethoscope. So this can occur in the rheumatic heart disease, that is mitral stenosis. Doctor will also check the blood pressure and he will try to rule out the hypertension. Doctor will ask, madam, do you have the diabetes? Because sometimes diabetic patient on the oral hypoglycemic drugs, some medicines can cause hypoglycemic attack with palpitation. Hypoglycemia, blood sugar drops down and the patient profuse sweatly, very sweating, very sweating, lot of sweating and the palpitation. Lot of sweating, palpitation, hypoglycemic attack. Here I would like to give you a very important tip for you. Whenever there is a profuse sweating, there are two important causes. One is a heart attack and second is hypoglycemic attack in diabetic patient. I think we are discussing the different things related with the 34-year-old female palpitation. We have diagnosed the cause is anxiety, tension, etc. Okay. The most important points for the palpitation. So doctor must ask whether the dhakka dhakka karne laga palpitation is a continuous or intermittent. Then pulse for the arrhythmia. Then doctor can check the pallor for anemia. Then doctor can check the thyroid for thyrotoxicosis. Doctor can check the cardiovascular system, inspection, palpation, percussion, auscultation. Doctor can check blood pressure. Doctor can ask about the diabetes also. Now, if all these things are normal clinically, the patient is treated, diagnosed as palpitation due to anxiety. And then doctor can prescribe tranquilizers and tablet propranolol, which is beta blocker. If goiter or the tachycardia is there, suspecting hyperthyroidism, T3, T4 level will be high and TSH, thyroid stimulating hormone, will be less. T3, T4 high, pathology more than hyperthyroidism. Okay. If cardiac cause is suspected, then doctor can do the electrocardiogram, ECG, X-ray chest, then 2D echo, and if needed, there is specific test which is called as a Holter monitor test for arrhythmia. And these cases should be referred to the cardiologist. So my dear friends, today we have discussed a simple palpitation due to the anxiety, but there are different causes that we must try to rule out. My dear friends, this is all for this simple video. I request all of you to like this video, share this video. And don't forget to subscribe my YouTube channel to boost Dr. Deshpande's energy, and also press the bell button icon to get the notification. Such interesting videos by Deshpande. I wish all the best. Take care and see you in the next video. Thank you.